He is going to be chatting with us. We actually have his bio there. And so we're going to keep moving very rapidly through the agenda. And thank you for being here, sir, and being patient with us.
Okay, thank you so much, Dr. Hancock. And thank you, Grow the Democracy Initiative. Thank you for the opportunity to be with you. I hope you can hear me very loud and clear. Can you hear me very well?
Yes, please going. And Roger, let's take down the slides, please. So we can have full screen.
All right, thank you very much, everyone. And awesome presentation so far by every participant and panelist. I've learned a lot in the panels that I joined. I think I joined from the panel 5. I had to be in another meeting, so I joined quite late. Apology for that. So I'll be addressing mental health challenges associated with the COVID-19 pandemic. By the way, I'm based in Lagos. I run a behavioral center in Lagos and also a behavioral change academy, all under the umbrella of Winbox. And interestingly, it's been our busiest time so far. The lockdown period between latter part of March and to date has been our busiest period. As a matter of fact, due to the rising psychological and mental health challenges, we've had to hire or increase the staff strength of our counseling unit from 5 to 11. So I'll be sharing a bit of my experience regarding these mental health challenges associated with COVID-19 pandemic from African perspective and a bit of some examples from Nigeria. As a background to this, we say this, COVID-19 pandemic has produced substantial health challenges from the perspective of both the direct health complications and the disruption to the delivery of standard care for individuals. And these as in a way, if you look at it in the parallel view now, caused a widespread application of social isolation initiatives in most countries. Now, these social isolation initiatives, as all of them together, have created a level of disruption in these countries, in African countries, and even in Nigeria, precisely. One of the disruption is the disruption in the way people work, the disruption in the way people socialize, disruption in the way people seek happiness or cope with stresses and shocks of life. And all these cumulatively have had a direct and indirect impact on mental health, also psychosocial balance for individuals and families. So another background I want to share with us so that we can be on the same page is this. Africa is not well prepared for mental health services, for mental health response to a crisis or a pandemic. As of today, in Africa, we have 1.4 mental health workers per 100,000 people. 1.4 mental health workers per 100,000 people, while the global mean is about 9 mental health workers to 100,000 people. So we are so far behind, far below the global mean. So this is a huge challenge. So that we can build a template for possible solutions to them. The first category of the mental health challenges emanated as a result of this COVID-19 pandemic is fear. Fear of the pandemic itself, fear of safety, fear for loved ones. And as a result of this, it has degenerated into a couple of other emotional trauma, psychological crises and the likes, worry, anxiety and the likes. By the way, let me quickly establish this. Let me not just be assuming that we're on the same page on this. Mental health is not the absence of mental illnesses only. Mental health is not the absence of mental illnesses. So in Africa, the tendency is there for people to think mental health, when you talk about mental health, it's that guy that is walking naked on the road or dressing unkempt. No. So mental health is not the absence of mental illnesses. According to World Health Organization, we define mental health as that state of well-being, and well-being ranging from your beliefs to your thinking patterns, to your feelings or emotions, and your behavior and attitude to life. So a state of well-being in which an individual is able to achieve the highest possible potential. And secondly, to cope or adapt to life stresses and shocks. Thirdly, to be able to work productively with people. Okay, I don't know where that sound came from. Then fourthly, to be able to contribute meaningfully to the society. So a state of well-being in which an individual is able to achieve highest possible potential of him or herself, is able to adapt or cope with life stresses and shocks. Thirdly, is able to work productively with people. And fourthly, is able to contribute meaningfully to the society. Now, situations, crises, challenges, pressures, and demands can alter any of these four expressions of mental health to manifest as mental illnesses or mental health challenges. And there are over 300 mental health challenges that have been documented globally across about 7 categories, ranging from the mood disorders like depression, anxiety, to psychotic disorders, to personality disorders, eating disorders, learning disorders, the likes. Okay, but the commonest one is the mood disorder, depression, and that's what I will be dealing with a lot because we've had a surge of depression and anxiety globally. And same for a lot of African countries. As a matter of fact, a lot of mental health workers have reported increased and overwhelming workload on themselves. I mean, according to some research done in some countries, they've discovered that calls across to the call lines, especially the suicide hotline, anti-suicide hotlines, has more than quadrupled in the last 2 months. So meaning that people are dealing with a lot of suicidal ideations or suicidal thoughts, which are traceable to the impact of COVID-19 pandemic on them. So fear has degenerated to a lot of the mood disorders like depression, anxiety, and panic disorders, and even triggered a couple of other mental health challenges like bipolar affective disorders and the likes. Then also, it's expected that substance use or substance abuse will increase. It's expected that domestic violence and relationship discord will increase, which you're already seeing. As a matter of fact, there is a report in Nigeria and in some other countries of increase in divorce rate and filing for divorce and even separation, because in Africa, specifically Nigeria, people don't easily go for divorce, but they might be separated. So we talk also about separation. So in which the husband and wife are living under the same roof, but they are not talking to each other. They are not possibly not even seeing each other. So we have a surge in all these mental health issues traceable to a lot of fear that comes with this pandemic: fear of safety, fear of being alive, fear of death, fear of the unknown, fear of uncertainty, and the likes. The second category of the challenge is the disruptive effect of the isolation or social distancing. So because of the isolation or the social distancing policies that governments across African countries put in place, so there's a limit in socialization, there's a need to work remotely, work from home, and children have to be at home, learning from home, going to school from home. I mean, e-school now, and parents have to be involved in their life there. You can't push them away to teachers to take care of them. So there's an increase in workload as a result of this on a lot of adults, especially parents. By the way, I represent a couple of organizations, global EAP providers in Nigeria. So I represent companies like Workplace Option US, Magellans, Kepcro, and Cigna in handling about 37 companies in Nigeria, their EAP on retainership basis. And in the last 2 months, we've had 7, by the power of 7, increase the number of accessing EAP service, that's Employee Assistance Program, just because people are dealing with a lot of workload, a lot of pressures that they can't handle: work stress, anxiety issues, panic issues, and depression. So isolation and social distancing policies have altered a lot of things, and the impact of this contributing to the surge in mental health challenges. Also, there's a reduction in household income. So far, it's said that about 40% of jobs were lost in Nigeria just within the last 2-3 months. Now, even those ones that didn't lose their job, there is a cut in salaries, take-home salaries for a lot of people working. And this has reduced the household income in Nigeria, and I know the same for a lot of African countries. This also is contributing to mental health challenges. Then the third category of challenges we are having with COVID-19 pandemic in terms of mental health challenges is the stigmatization. There is this level of stigma that is associated with someone that is isolated or quarantined for a period of time. Now, one of the things that WHO, World Health Organization, is doing to avert this, which the awareness is still very low, is to encourage people to avoid referring to people with the disease as COVID-19 cases or COVID-19 families or COVID-19 disease. So we're advocating that people should refer to them as the people who had COVID-19 or who has recovered for COVID-19, because you have a situation in which someone was quarantined and undergoing treatment and eventually recovers and return back home. Then the neighbors start tagging such a house. That's the COVID-19, that's Corona house. That's Corona family. And that stigmatization itself can degenerate the mental health or the psychosocial balance of individuals and families. So stigma is a major issue in Africa that we're dealing with, and all hands have to be on deck to be able to deal with it. So in order to tackle this, it will not be it will not suffice to just share the challenges alone without dealing with possible solutions. Possible solutions I penned down here, we cut across 4 categories: individual level, organization level, then social groups level, then government level. So for individual, one of the things we've been doing is to make information about the practice of mindfulness and the skill of resilience to be common. So whether it's on radio or it's on social media, by the way, a couple of weeks ago, we had to quickly host a 1-week conference called Unstuck Conference to deal with the emotional and psychological impact of COVID-19 pandemic. And majority of the questions people were raising essentially have to do with how do I deal with the workload, the increase in workload, juggling between work and home, working from home, dealing with my spouse, dealing with my children, or my salary has been cut down by 40%, or I just lost my job, or I'm scared that I might lose my job, and the likes. So we encourage the practice of mindfulness, which essentially is about being able to channel your awareness or your attention across 3 outlets. And this helps in preventing or averting mind wandering. So you're able to channel your attention or awareness into the present on purpose and non-judgmentally. But that's not the focus of this discussion. Let's move on. Then the same thing with resilience skills. So on individual level, there are also tips that the World Health Organization has released. We make a lot of infographics about this to be available on social media. And we try to encourage the media, also the media outlets, to push this out. Why also trusting that the government will do their part. But on the second level of response or possible solution to these challenges is the organizational level. And for organizational level, I'm talking about corporate organization, and on the flip side also, the faith-based organization. In Africa, we are quite religious. So anything we are doing for it to be effective and successful, the faith-based organizations must be involved. So on the corporate level, one of the things that we are encouraging organizations or corporate organizations to pick up or activate or implement is what we call EAP, the Employee Assistance Program, such that their workforce can reach out to a particular line that is a psychological crisis line for counseling 24/7, and it's reliable, it's confidential, it's free to the workforce because the corporate organization or the employer has paid for it. Then also, we encourage the human resource department of organizations to pick up a skill called mental health first aid. Just the same way we have physical first aid, we have mental health first aid, in which they can quickly spot mental health challenges or evolving mental health challenges in their workforce and be able to support appropriately to the right listening skills, empathy, and communication. And that's why World Health Organization has said that empathy is a necessary skill in combating the rising mental health challenges that is associated with COVID-19 pandemic, if we don't want to have another pandemic of mental health issues in the nearest future. And we put it as a slang: compassion is a medicine. So And in order to have this compassion, it's always good for these HR practitioners or managers in organizations to go through this mental health first aid skills so that they can spot and support mental health challenges among their workforce. Therefore, for faith-based organizations also, we've been
Dr.
doing
Ozaz, 2 more minutes.
Okay, good. Across the faith-based organizations, and I'm referring to Christianity and Islam largely now because they are the major religions in this part of the world, we are advocating for a mental health unit. I joined a pastoral leadership conference 3 days ago as a speaker, and I try to encourage every ministry, every faith-based organization to implement a mental health unit in their ministry. Because the truth is that the first point of call in Nigeria and most African countries for anybody dealing with mental health challenges to reach out to a pastor or an imam. And if we don't equip them with these skills in terms of mental health response skill, we'll be losing a lot of counselors, the pastors, the religious leaders to pick up mental health first aid skills so that they can communicate rightly and also counsel. Then lastly, for government, that's where we have the biggest challenge in Africa. So far, so good. Some governments are trying to improve, like South Africa, like Egypt and Kenya. My country seems to be trying or claims to be trying, but the truth is that they are not yet. Today, the Mental Health Act we have in Nigeria is still the outdated one in 1991. Several attempts to repair or repeal this or improve on this are prove abortive. But some state governments are doing the necessary things to improve. For example, Lagos state government has a psychological crisis hotline or an anti-suicide hotline that people can call and reach out to counselors for free. And this is highly pertinent because we're having a real surge in depression and anxiety issue. And one of the things that government can do is also legislation against stigmatization of mental health issues, especially stigmatization of people that have just recovered from COVID-19. Then also mental health centers. Like I said earlier on, we have 1.4 mental health workers to 100,000 people in Africa. Similar ratio in Nigeria. As a matter of fact, we are in dire need of psychiatrists and psychotherapists and counselors in Nigeria. Government must do something to encourage more people or retaining these experts in Nigeria and not having bringing or then seeking greener pasture in developed world. Then we must introduce more mental health centers. The mental health centers we have available majorly in Nigeria today, they are those that are in standing alone as a psychiatric hospital. And people, because of the stigma associated with psychiatric hospital, they would rather not want to go there. They would rather go to their religious leader. But we can have a lot of health centers around and make it common. The stigmatization can reduce. And lastly, awareness. There must be an aggressive awareness across all the traditional and new media concerning mental health, what to do, what to support in yourself, and where to seek help. A lot of Africans still go to the wrong places, wrong religious centers, wrong traditional centers, such that is when it has advanced to severe stage, they will now report back to the mental health centers or to the hospitals. And at that point, it becomes more difficult to manage. We wait for the questions to see.
Okay, yes, we'll have questions at the very end. Thank you very much for being with us and giving us a dynamic presentation. Next up is